Hi, everyone. It's so great to see you. And I'm tremendously excited to see so many of you gathered here today. My name is Carmel Tess, and I would like to say a few words about Dr. Butto and the training he offers. Dr. Butto is an internationally known cardiologist who has conceptualized and developed the Unified Integrative Medicine method. While still studying in his medical degree, he was asking questions which he could not be answered by conventional medicine. So he began searching for answers in Eastern philosophies and various alternative therapy methods. As a cardiologist, he worked for 30 years in one of Israel's most leading hospitals, while also expanding his knowledge and research of the mind, quantum physics, mathematics, chemistry, shamanism, while consolidating an innovative and integrative approach to medicine. Dr. Butto is an internationally esteemed therapist. He published books and scientific studies. During the corona pandemic, he established a center in Israel where treatment, research, teaching, and training of the method is happening. And nowadays, his training are being done in Hebrew, Italian, very soon starting in Arabic. And we're looking forward to start the second cycle of the English-speaking training in June this year. Today, Dr. Butto will talk about the Unified Integrative Medicine. And it is very important for you to know that if you would like to continue for the training, this is open to everybody who feels a calling to the realm of body, mind, and spirit, and to deepen his understanding of life. So the training itself includes 7 modules, 5 of them are online, and 2 modules are in person. If you would like to continue to the qualification training, this will certify you to become a therapist in the Unified Integrative Medicine. So if you would like to know more about the training, you're welcome to stay until the end of the talk, and we will explain more about it. During the lecture today, my colleagues Roy, Karen, and me, Carmel, will be available in the chat to answer your questions. So the lecture is scheduled for about 1.5 hours, which at the very end, Dr. Butto will allocate time to answer some of the questions. So I would like now to invite Dr. Butto to take over. Thank you very much.
Thank you very much, Carmel. Wow, it's a pleasure for me to be with you tonight and to present for you the Unified Integrative Medicine and the need, why we need it so badly. I can see that we need to change the paradigm of medicine, and in order to convince you, actually, I believe that many of you are convinced already, and this is the reason why you are here tonight. So I want to show you the information and the data about what we have today in our hands in medicine, in conventional medicine, and how we can change the paradigm in order to integrate between the physical body, soul, and psyche. So the integration is not a question of a combination of different methodology or disciplines of alternative medicine. No, the Unified Integrative Medicine is to integrate from the basis, to integrate between body, psyche, and soul. And in order to do this, we should understand and define every one of these components very precisely in order to understand how the psyche, how the psychological conflicts converts to physical diseases, and what is the soul. When we speak about soul, this is the most difficult issue that many are arguing about the presence or absence of the soul. If it's real, it's scientific, it's we can speak about it in scientific terms. And what we will discover during the courses that actually this is the most real reality. I mean, our reality that we believe that this is the reality is only 4% of the reality. The physical reality is 4% of our reality. Most of our reality is not in the physical world, but it's in our imagination, our thoughts, and our dreams, in our fantasies. So most of our life is in the realm of the spiritual world, in the realm of psychology and spirituality. So we want to make a kind of panorama, very quick panorama about what we are intending, when we speak about a unified integrative medicine, what we mean by this. So the first thing is we admit that the traditional medicine has a successful very successes in reducing the mortality rate and infant mortality rate during the decades, and mostly this is due to the fact that the hygienes is completely changed, and it's not related actually, and we have studies that demonstrate that this reduction, infant mortality reduction rate, is not so related to the vaccines, but to the changing the hygienes and the quality of life, actually. And here, good. Now, we have a success as well in reducing the myocardial infarction mortality. And this is one of the great successes that we have in medicine. And this success is not, we didn't see this in, for example, oncology or in chronic diseases. So the life expectancy has risen as a result of the significant decline of mortality. But we still see a lot of new cardiac diseases and new myocardial infarction, although the mortality was reduced. So in cardiology, we have a lot to change because we have a lot of paradoxes in medicine and especially in cardiology. First of all, we can see that these paradoxes tells us that we have to change our theory, our current theory. Instead, in each paradox, we add these paradoxes in medicine. Just the French paradox. This is the observation that there is a low coronary heart disease death rate despite the high intake of dietary cholesterol. And you can see the curve that in spite the fact that you can compare, for example, Finland with France, they have a comparable quantity of cholesterol saturate index in the blood. Still, the mortality is much different and much lower in France and Switzerland. The same thing that you can see that if we compare in the 7 countries study, we can compare the values of cholesterol in the blood and the mortality rate. We find that it's 5 times higher in Northern Europe than in Mediterranean Southern Europe. Till now, there's instead to see our theory and to change it, we say, yes, this is a paradox. There's another paradox. So the Japanese paradox, the same thing. In spite of the fact that we have, with the time, increase in the level of cholesterol in the blood, still we have decreased in mortality. Comparing this to other countries in Europe and United States. So we have no explanation, real explanation, because if we attribute the mortality and the heart disease to these risk factors like hypertension, hypercholesterolemia, smoking, and diabetes, and still you see that you have a paradox. Instead to review the current theory, we say, well, the theory is good, but we have a paradox here. Another paradox, this is the Japanese paradox. Another paradox, which is related to Japanese as well, is related to smoking. The Japanese are the most higher smokers in the world, because they are 34% or 35% of the Japanese are smokers, and the rate of coronary heart disease, you can compare this in Japan, is quite 1/3 in relative to US or United Kingdom. So if we attribute the heart disease to smoking, so here we have the evidence that's not related. So something is not functioning here and something is not clear. We have to take this in consideration and maybe to change our view for these risk factors. Another paradox is the Israeli paradox. The Israeli paradox, if you compare the citizen in the United States and Israel, there are very fewer calories in Israel, and they eat less cholesterol. Still, they have comparable rates of heart disease. What we see that the diet is rich with linoleic acid, which is rich with omega-6 fatty acids, and this fact is related to the fact that in Israel they don't like to eat the butter or all the milk that is rich with cholesterol. And in spite of the fact that the cholesterol in the diet is less, much less than in the United States, still the heart disease is the same. So they call this the Israeli paradox. And we have the Indian ASEAN paradox as well. They don't have risk factors for heart disease. Still, they have twofold higher heart disease than Americans, for example. And if you compare an Indian physician that is working in the United States with the American physician, you can see that the Indian physician has fourfold higher prevalence of cardiovascular disease. And still, it's not clear why. And this is the reason why actually we call this the Indian Asiatic paradox. We have another paradox. It's Girona or Girona province paradox. They have high prevalence of risk factors contrasted with low incidence of coronary heart disease. So they have all the risk factors. They are obese, and they are smoking, and they drink alcohol, and they have high cholesterol, and still they have very low incidence of cardiovascular disease. So we don't have explanation for this. So we put this as paradox. So instead to review the current theory and say something not functioning here, we add paradoxes all the time. And you can see here, for example, that the prevalence of the chronic diseases are continuously increasing. So there's something that we have to ask ourselves if all the chronic diseases are increasing, something is not functioning in treating the disease and to convert the disease in chronical disease. So again, we have to review ourselves and to see here, you can see the obesity, for example, in all the world that is increasing and is expected to continue to increase all the time. And this another factor, the same as the diabetes, type 2 diabetes. According to the World Health Organization, we see the diagram and the curves in all the world that the diabetes is increasing all the time. The prevalence of chronic diseases in the United States and in all the modern countries, all the developed countries actually, in 2025, half of the population will have at least one chronic disease. So we have a lot of data here that we should revise ourselves again and ask ourselves, maybe we should change something. Here another paradox, which is called Peto's paradox. Peto's paradox comes to contrast the theory that says that we have cancer because we have mutation in the cells. And the more cells we have, the more chance to have more mutation. And the more time the organism live, more chances to have mutations and cancer. But in Peto's paradox, they observe that the incidence of cancer does not appear to correlate with the number of cells in an organism. And you can compare this, for example, in humans and rats. They have the same incidence of cancer, despite the fact that the number of cells in humans are much larger. And the same thing with elephant and blue whales. The bigger is the animal, the lower the incidence of cancer rate. And this is something that asked us to change our view, what is cancer? Because something is not functioning as well here with the cancer theory that says that actually the cancer is a mutation in the cells. And in the elephants and blue whales, they live long and they have, for example, the whale, it has 10,000 more cells than the human being. Until still, there's no cancer observed in the whales, for example. And this comes to tell us that here, all these things ask us to make a change in the paradigm. To change paradigm, we have to review ourselves from the beginning and ask, what did we do wrong in the way? So what we see here, that the main thing that we didn't do, we didn't apply the definition of health according to the World Health Organization. So the World Health Organization defined health as a state of complete physical, mental, I add spiritual. We will see that the spiritual part is the most important part, and social well-being, and not merely absence of disease or infirmity. So the World Health Organization tells us that health is not absence of disease, as we are doing right now in the conventional medicine. Because if somebody comes to the hospital or to the family physician and you have headache, gives you the bill, against the headache, and that's it. You have inflammation in your knee, you have the anti-inflammation therapy. And we think that by this, we obtained the well-being. But this is the absence of disease, not a state of well-being. So the well-being is, we can define well-being as a state of mind in which the person feels able to realize his projects in life with a sense of love, happiness, and freedom. This is the well-being. So if you don't have this, so you should ask yourself, how many people in the world they have good health? Because if you don't have the state of well-being, so you are not healthy. So we have to ask ourselves and to redefine again the definition of health according to the Health Organization. Now, in order to apply this, we need a holistic model. We need a holistic model that views biological, mental, spiritual, environmental, and social factors as interconnected and mutually influencing. So we cannot separate the psyche from the body. We cannot separate the soul from the body and the psyche. So we have to see everything that we have in our lives, at work and in family, all the our challenges and issues that we have in different aspects of our lives. They are relevant and important in order to take in consideration actually the well-being. Now, in order to apply the holistic model, actually we need the theory that can unify everything. Actually, we need the theory of everything. We need the theory that can explain to us everything in a way that is connected. And as you can see here, we have different levels of theories, which is started from the Unified Universal Theory. And the Unified Universal Theory respond to the definition of the theory of everything. According to Karl Popper, the theory of everything should be the one that describes a broad variety of phenomena with a few arbitrary parameters, and the theory that is capable of positively predicting results of future observation. So we are looking for this theory that we can unify everything that we have in this cosmos, not in this universe, in this cosmos. And what we will see in these courses, we will start in the first course to see the universal laws, 7 universal laws. With these laws, we can explain quite everything. So this 7 universal laws is the basis for the holistic model. And on this basis, we developed this unified integrative medicine, where we emphasize the prevention by obtaining the state of well-being. Because if you have the well-being, you don't need the disease, because for us, the disease is only a sign that something in your system is not functioning well. And this is not the problem. The disease is not the problem. It's only the sign. And we will see that for every psychological conflict, we have an exact address in our physical body. So if we are aware about this, we can intervene very early and resolve the conflicts in order to prevent the development of suffer and organic disease. So this unified integrative medicine actually has diagnosis, therapy, and prevention, and all of this in order to obtain the state of well-being. Now, the same thing that Karl Popper defined what is the theory of everything, the unified integrative medicine actually describes a broad variety of medical issues without paradoxes. This is my definition. We don't need paradoxes. If the theory is right, there's no paradoxes in the theory. And this unified integrative medicine is capable of positively preventing future diseases. So just to give you little bit information, little bit knowledge about this theory, we start by saying that actually we have in the reality, our reality is composed of three components: information, energy, and matter. So this is fine for everything in our reality. We start with the universe and we arrive to our system, which is made of information, energy, and physical body. So we have to take this in consideration when we are dealing with health and disease. And by integrating the three parts of soul, psyche, and physical body, we understand actually that we cannot treat the person as only physical body. We cannot treat the person as organisms that has a chemical reaction inside the physical body, and we cannot define life as a series of chemical reaction inside the cells. This is not the life. The life is opportunity for the soul in order to make a kind of internship, in order to learn and to change and to evolve. And this is a real aspects that we have to take in consideration. Actually, this is the main thing when somebody comes to me in order to heal or to help him or her to heal. The first question I ask: why did you come to life? Why did you come to life? And most of the people, they don't know exactly why. This is a question that nobody thinks about it. The second question is what I'm asking: who are you? So these two questions can define exactly the purpose of our life in order to create a path, and in this path of evolving, in this path of developing, and the main thing is the spiritual aspect. So we come back to the spirituality, because without this we cannot understand the essence of life. So in order to introduce the spiritual part, I published an article in International Journal of Psychiatry Research, where I integrate the spirituality, because without the soul, we don't have an explanation for the real nature and essence of the psyche. What is psyche? What is mind? Where is the mind? Is the mind in our brain? Is our consciousness in our brain? These are the questions that still not resolved till today. So when we introduce the spiritual aspect, we have a resolution. We have solution for these problems. So these three parts, soul, psyche, and body, and we can say that every human being presents a biological complex subjected to the energetic forces that guides physiological, genetic, metabolic, and psychological functions. These forces are called the soul. So soul is the energy and information that gives life and intelligence for the organism. Without this, we don't understand what is life. So there's no life without energy, and there's no life without very precise and intelligent energy. There's no random, there's no chaos, there's no just chance, by chance that the world is created like this, but we have very precise laws that guide everything in mathematically very precise matter. This is the reason why I found myself dealing with physics, because I wanted to answer the questions about the nature of the soul. So I started to ask questions about the energy. I started to ask questions about the information. I started to ask questions about the elementary things like what is particle, what is the electron, what is a photon, what is gravitation, what is inertia. So it seems that everything is clear and everything is known already in physics. But when you go deeper and ask this question, you find that there are a lot of paradoxes in physics as well, and a lot of things that are not known, upon which all the theoretical physics is based. So, for example, if you take all the constants in physics, you have a lot of constants in physics, more than 20 constants, these numbers that you find in the equation, but without explanation where these constants came from, why we have to add these constants in the equation without understanding their essence and nature. And I found myself writing about this, and I published in these 3 years. In the last 3 years, I published 13 articles in physics. You are invited to look. You can write in the Google, for example, Nader Butto and the vortex, or Nader Butto photon, and Nader Butto gravitation, and you will see the journal of high energy physics, gravitation, and cosmology. And there you can find all the articles that I published that were past the peer reviewers, and brings you new theories, actually new theories in physics, because we need this in physics as well. So we need to change the paradigm of our basic information. And this is a very hard task, but I think once we have the model, once we have the basic universal basic model, everything will fit in this model without problems, without difficulties. And this is the unified universal theory. So we come back to the soul, and we understand that this soul is divided in 3 parts. And this division makes everything easy after that to understand. The first part of the soul is energy, and this actually is the magnetic field that we find it inside and outside our body. This magnetic field has information and has energy. And this magnetic field has 2 poles, has lines, magnetic lines, which are called meridians according to the Chinese culture, and has 7 chakras according to the Indian culture. And these chakras actually are vortices which brings the energy, the magnetic field energy from outside to inside, where beneath every chakra we have endocrine gland that absorb this energy, and by doing this creates a kind of vortex, and this vortex is a part of the magnetic field. So we understand better many alternative medicines which are related to chakras and meridians. For example, acupuncture. When you are speaking about acupuncture, you go to the Chinese doctor and you have shoulder pain, and he does for you the acupuncture, but he does not ask the question why we have the blockage of the meridian of the lungs, for example. It's not enough to open the meridian. I want to understand what lies behind this. Otherwise, the meridian will be blocked again and again. So without taking consideration the psychological aspect, we don't resolve the problem. So we need to go to the origin of the problem. Now, for me, it's not enough to identify the psychological conflict, because behind this, we have the potential of learning process. So if we don't reach this and we don't complete the learning process, we do not take in advantage, we don't change, and we don't learn. So we will find ourselves again and again doing the same mistakes in life, which are actually opportunities to learn from these mistakes, from these challenges, and from these difficulties and obstacles. So the animal soul, we find all the animal instincts in the animal soul, actually, that makes all the order and maintain in a perfect order all the chemical and electromagnetic activity in our organism. So this is the reason that I call this the magnetoelectric field, not the opposite, not electromagnetic, but a magnetoelectric, because this is the sum of all the magnetic fields that are merging together to create one magnetic field. And this magnetic field influences the reaction that we have in each cell, in each organ, in each system. So we will understand better that when we have a psychological conflict, this psychological conflict will create a dissonance in the field. So it will change the vibration, the frequency in that area. For example, we have a sense of lack of love from parents. This makes the person suffering and will create a dissonance on the field around the liver. So by changing the frequency, it will be a dissonance between the field of the liver and the liver, because the liver itself as a matter is energy as well. So we need to have a constructive wave interference. That means that the energy frequency of the field and of the organ should be the same. And what I found out, when we have conflict or trauma, the frequency of the field changes, and this change actually create the dissonance between the field and the physical body, and appear what we call the destructive wave interference. So one wave is against the other, and one wave is canceling the other wave, and in this way the vitality of the organ will drop down, and as a result the disease will appear. So we have a physical mechanism that we can explain the disease. Okay, this is the magnetic field of the animal soul, and this is the morphogenetic field as well. The morphogenetic field, that means the field that create the structure of our body, our physical body. So this magnetoelectric field is responsible for the physiology and for the anatomy. And we will see that in anatomy, the structure of the organs is not casual. There is a very precise model that creates the shape of all these organs. Because if I take, for example, cells from the heart, and I just grow these cells in Petri Petri dish, they will multiply. But we never will see a heart that's created from this. Even we can see that these cells are contracting and relaxing, but will never create a heart, because the shape of the heart is not written in the DNA, in the genetic material. And this is very important. There's no information that says that how my nose will looks like. And it's not genetic as all people thinks. They think that the genetics that determine my shape, and it's not. We have the epigenetics that activates some part of the DNA. But these epigenetics still not determining the structure of our body. The structure of our body is related to the morphogenetic field. The second part of the soul, I call it human soul. This part will join the newborn in the first moment when it will take the first inspiration, and this is the name of inspiration, came from the word in spirit, when the spirit it joined the body, inspiration. And this is a not energy, the human soul, and the third part, which is the guiding spirit. They are not energy, but they are a state of information. They are quantum state. If we understand what is quantum state, because even in quantum physics, many things are not clear, and they have no explanation. And with this system, we can explain even the quantum physics very clearly and very simply. Everyone can understand the quantum physics. You can understand that actually quantum state is quantum of information. It's something that is distinct and is, you can differentiate quantum state from another quantum state because the information and the vibration is different. So the human soul is a quantum state which join us in the moment of the birth. And this is the source of our consciousness, the source of our awareness. And this is the real essence of the human being. And this is the part that distinguishes the human beings from animals. We cannot distinguish from our genes. There's no way to say that we are different from animals because our genes are different. Because 99% of our genes are the same as the chimpanzee. Still, we are completely different than the chimpanzee. We cannot attribute this to the structure of the brain because the difference is so small comparing to the high difference between animals and humans. So the difference is not the brain. The difference is in the human soul. And the human soul This part that right now I'm speaking with you, this is the human soul. The animal soul is based on the principle of pleasure and expectation. The human soul based on the principle of loving and serving. So we came here in order to understand and to learn from the needs of the animal soul, and the not only the needs, the disappointing that we have from the animal soul. This is the origin how we can understand and learn all the things that you expect to have for yourself, and it did not happen. These are the things that you should learn what to give for others. So by this and by the principle of happiness, we have two signs, happiness and suffer. The happiness tells us that we are going in the right path. Go on. The suffer, it pushes us to make changes because nobody wants to suffer for a long time, you know. So I start to look for something else that I can come out from this suffer. And by doing this, I learn new things and I grow due to the suffer. And I evolve in my soul because I learn new things. And I become a better person for the others. I can serve better. I can love more. And this is the spiritual evolution. The real reason why we are here, we came in order to grow spiritually. And everything that we have in life, physically, are tools for us in order to do this. Once we understand this, our vision for life changed completely. We understand exactly why we are here, and what is the purpose. So this is the second part, and the third part of the soul is the guiding spirit. The guiding spirit is a quantum state as well, and it joined to the person at the moment of naming the person. The name of the neonate and the name of his mother will determine the quality of the guiding spirit, which is the source of our intuition and the source of our sixth sense and the origin of our geniality. So these are three parts of the soul. They are three in one. And actually, this is the third law. The third law is the law of Trinity, which says that everything that is stable is made of three. And this comes to tell us the origin even of the three parts of the psyche that we will see. So the animal soul is a magnetic field or the morphogenetic field that guides the anatomical structures and physiological functions. It's the cause of life and emotions. So our emotions are related to the animal soul. So the more we grow spiritually, the less we'll be emotionally. And this is something that it seems not understood, because we think that we have to be emotional in order to be humans. And this is not correct. We have to be more compassionate, but less emotional. We have to be more empathic, with empathy and more compassion. And we need to be more happy. And happiness is not emotion. And we will speak about this and we will define this. The human soul is immaterial. We cannot say that is energetic because it's actually related to the energy of the animal soul. It's quantum state, which is the source of consciousness, identity, transcendental wisdom, the spark of light, which when it animates or gives life to the physical body will be the spring of love, compassion, and search for meaning, purpose, and truth in life. The guiding spirit is independent quantum state as well. It's called a spirit because it's outside of our physical body. When the spirit animate the physical body, we call this soul. And this is the difference between soul and spirit. The spirit is without physical body. So it's from outside influence our existence and our thoughts. And we take the animal soul, we divide it in 3 parts as well. And we integrate between different disciplines that have developed in different cultures. We understand better that it's not enough to influence and to resolve and to open energetic blockages, because behind this, we have the psychological aspects and emotions. We understand better the interaction between male and female, because both we have these poles, magnetic poles, which are the basis of the sexual attraction. And in order to have this attraction, we have to be compatible one with the other. And normally, from the positive pole, from the pelvis of the male, the energy goes out to enter in the pelvis of the female. From the positive pole of the male goes to the negative pole of the female in the pelvis, and from the positive pole of the chest of the female goes to the negative pole in the chest of the male. And this explains the difference of love, kind of love. The male loves sexually, and the female loves emotionally. And one integrate the other, and one complete the other. So when you love, you are happy. And when you receive the love, you have the pleasure. So when you are giving and you are emphasize the giving, you are emphasize the happiness, you will find that outside people starts to behave like you, because similar attracts similar. That mean like are attracts. So if you are in giving and loving, you will find people outside that they are doing the same with you. If you are egoistic and you want love for yourself, what you are creating actually is lack of love. And what you will find outside only lack of love. So this comes to aggravate the situation in order to understand better actually that you have and you need to change this in order to be the source of love, to be the one that looks for happiness, look for freedom. Because when you love, you are happy. And when you are happy, you are free. You are not dependent on the things or people around you that gives you something. You create, you become the source of giving and loving for the others. So this is a new theory actually about sexuality. And this theory, we will see that it explains the homosexuality and lesbianism, and we will speak about this more deeply. Now, many could say that, well, this is a very theoretical and it's not, there's no evidence, scientific evidence that there's such a thing, animal soul. If we accept our definition that the animal soul is a magnetic field, we have the evidence of this magnetic field, and we have the device that is called SQUID, superconducting quantum interference device, that can capture not only the magnetic field, but even the information from the magnetic field without any connection. For example, we can do magnetocardiogram instead to make electrocardiogram. We can make magnetoencephalogram. We can magnetoretinogram, or we can the magnetic activity of the brain, of the retina, of the fetus. We can actually capture information which is more information than the electrocardiogram or magnetocardiogram. So we have here a device. It's quite expensive, about $1.5 million. This is the real cost of this device. So still, there's no lot of many physicians are not aware about the presence of this quantum device, but this comes to confirm actually that we have this, and we can speak about the magnetic field. This is the magnetocardiogram that you can see here from the image, that capturing the activity of the heart without any physical connection. Now, the interaction between the soul and the brain produces the psyche. So without the soul, there's no psyche. And the fact that the soul is divided in three parts, animal soul, human soul, and guiding spirit, it will explain completely the nature of the psyche, because these three parts, ego and superego, has no explanation till now, in spite of the fact that more than 100 years since Freud described their presence, and you know, they do every effort possible in order to find these three parts in the brain, and they didn't find it because they are not in the brain, because the brain is only the tool that can analyze the information that has in the soul, and it appear as a part of the psyche. So the id is the origin of our emotion, and the ego the origin of rational mind. So when we speak about mind and psyche are not synonymous. They are completely different, because the mind is one part of the psyche. We have emotion, mind, and we have intuition and moral aspects, which are related to the guiding spirit, and the superego, which is related to the guiding spirit. Here we can understand better the wave interference. So when we have two waves that are in the same phase, they have the constructive wave interference, and we call this resonance. And people who are in a state of happiness, because they are based on love and giving, they will have more strength in their body, physical body, and they will feel that they are healthy. And what does the psychological conflict or trauma actually is create this dissonance, because the phases of the waves between the magnetic field and the physical body will start to have this destructive wave interference and weakening the energy, the vital energy of the physical body, and creates the disease. So we have a physical mechanism which is very clear how it's functioning. Now, another thing that is important, I published an article where actually I present a kind of a map where every conflict, psychological conflict, has a very specific address in our system. For example, if you have a conflict of separation from beloved one, your heart will be involved, and then the cholesterol start to function as a negative way. So it's not the risk factors that makes the disease. The risk factors are manifestation that there is a problem in the system. But if you have high blood pressure due to material conflicts and not emotional and separation, and the high blood pressure is related to kidneys in this situation, even though that you have the hypertension and you are smoking and you have obesity and you have other risk factors, you never will have the cardiac disease. And sometimes you have the conflict and the blockage and the blockage of energy in the heart due to the conflict without having any risk factors, then you will have the disease in the heart. So the most important thing is the conflict and the organ, and each organ has very specific conflict. So we have a kind of map for all the body where I connect even the chakras and meridians and other organs that they are not related to chakras or meridians, like esophagus, for example, or uterus. Uterus is not related to any of the chakras or meridians because the chakras are related to the endocrine glands and the meridians are related to organs, and the uterus is not related either to chakra or meridian. So but it has a very specific relationship with conflicts. Now I give you an example. For example, the colon. The colon is involved when there's fear of criticism, critical fear, or you are very critical for others. So the colon will be the organ that involved in this. In the same way that the stomach, for example, when there is an event that was not expected and you cannot digest it. So the organ of digestion is the stomach. And this is why the stomach will be involved in the disease. Now there is another question, why the same organ, which has very specific conflict, has different kinds of diseases. For example, in the stomach, you can have gastritis. You can have excess of mucus. You can have ulcer, gastric ulcer. You can have, for example, a cancer. Now, for this, we have a theory, new theory as well. And I relate this to 4 phases of life, which are excitation, expansion, contraction, and relaxation. And each one is related to one stage of the one phase of the stress. And each stage of stress is related to one grade of fear. And how the person lived the conflict or the trauma will determine in what of these 4 stages of stress and life will be blocked. And according to this, for example, if it's blocked in the phase of excitation, we will have gastritis. If it's blocked in the phase of contraction, we will have ulcers. And we can understand actually all the ulcers in different parts of our body in the after, or for example, Crohn's disease or colitis, ulcerative colitis. All these are a blockage in the phase of contraction. The same way we can say that all the cancers are blockage in the phase of relaxation when there's not enough energy. So in this another article here, I explained the relationship between 4 phases of life and 4 stages of stress, that explain the different kinds of diseases in the same organ. And I present a kind of flow that you can understand and you can distinguish between the positive stress, which is called eustress, and negative stress, which is called distress. So not every stress is negative. Many of us, they are pushed and they are functioning well when they are under stress. And due to this stress, they are very productive and they feel good that they are achieving their purposes of life. Without stress, they are not functioning well. And if you are learning and you are progressing and you are evolving due to the stress, this is it's called eustress, and this is a positive stress. And the negative stress, distress, actually, when this will block the energy flow, you are actually, why we have conflict? Why we have conflict? Because I didn't accept the event in my life. I reject the event thinking that this is something against me. The animal soul wouldn't like things that they are not related to pleasure. So if there's no pleasure and there is threatening maybe of going away from pleasure, and this will be rejected from the animal soul. So when you reject an event in your life, that moment, actually, the crisis and the conflict will be created. And behind this, you have a learning process that were blocked as well. So if you didn't learn, this kind of conflict will repeat again and again. And I say that God is generous. If you didn't understand from the first time, it will give you a second opportunity and third and fourth and so on, till the point that you will understand and make the changes and accept the fact that nothing happens to you that you don't need it. All the things that we don't need it, we don't observe their presence. It will be neutral for us. All the things that are relevant for our evolution and our spiritual growth, they will be relevant for us. And exactly, we will find there the potential for learning. So if we have potential of learning that's blocked, we have two situations. If I have enough energy, that will cause me, will disturb me, without having disease. But if my energy goes under a certain level, then the disease will appear. So in order to have a disease, we have two components. The first one, we need to have a stress due to a conflict that's not resolved. And the second thing, that the vitality, the energy, the vital energy in the organ drop under a certain level. For example, if we take the cancer, this level is scientifically identified, and we can measure it. And you can measure it by millivolts. If you measure all the cells, the cancer cells, you will find that there is a measure of less than 36 millivolt, the membrane potential, the difference between inside and outside the cells. And the normal cells never drop under the 40 millivolt. It goes between 40 to 97 millivolt. This is the membrane potential of normal cells, normal organ cells. Now, if we understand this, we understand that we should consider the cancer cells are poor cells. They need to help. We don't need to declare war against the cancer. If I declare war against the cancer, like I declare war against the children in Africa, because they don't have enough to eat or to drink, and we should kill the children in order to resolve the problem. Wouldn't be logical. The logic says, if I want the Africans to stop to make a lot of children, convert them to be rich. As a matter of fact, all the rich people in the world, they don't make children. And the more your standard high, the living standard high, the less children you have. And this is the same principle that we have in animals. The more the animal is strong and to protect their babies, less babies they will have to produce. You compare the rats with elephants, for example. So we understand better this way as well why the big animals, they don't have cancer. They are not in a state of threat. There's no threat for the big animals. So from this, we understand that our approach for cancer would be completely opposite, 180 degrees opposite. So instead to kill the cancer cells, we should nourish and give energy, vitality, in order to make this potential, membrane potential, from 36 to pass the 40 millivolt. And in that case, the cells will stop alone to multiply. So we change completely our approach for cancer. And we understand why the current approach is not functioning. So this is the diagram that we can understand from here, the origin of the disease. And we ask the purpose of our life, where we come here, and we understand actually that we came here not in order to find the meaning for the life, but we come here in order to discover the best of ourselves, and to do this actually the best for the others. So I want to be more loving and caring and compassionate with the others, and this is the secret of our happiness in life. So we can redefine what is health now. We understood that we have the magnetic field and we have the physical body, and the health is a state of resonance between the physical body, mind, and soul, in which the defense system is not the immune system. The defense system is the energy, the vitality, is able to cope with external and internal stimuli in an efficient way to report the state of homeostasis. And homeostasis, we defined it as a dynamic balance due to the resonance between the psychospiritual energetic field and the physical body, in which the system functions properly with the minimal energetic consumption. So the right thing, sorry, the right thing is the thing that does not need a lot of energy. So here we can understand that the quality of our life is actually related to different aspects in our life that we should take this in consideration. And we can understand better that in order to live better, the main thing, I give the way and the path for my patient to find the personal fulfillment and to go in the path that the person could understand better why he is here and what the purpose of life and why we did have all these conflicts actually, and to resolve the conflicts and to complete the learning process. You know, this is a very wide, and you can imagine that we have 7 different courses. Each one has very much information about our lives. And actually, this is not kind of a system in order to heal the others, but a system in order to heal ourselves and to become a model for the others. And this is the best way that we can help others in order to feel better and to achieve the state of well-being. The time, is very short in order to take in consideration all the things, but I prefer to give some space for answers. We start with Milad. Welcome, Milad. أهلا وسهلا. Milad, you can open your microphone.
السلام عليكم.
وعليكم السلام.
كيفك دكتور نادر؟
الحمد لله تمام.
يعني شكرا على القيمة اللي تقدمها. يعني شكرا. يعني حبيت أسألك عن مشكل صحي هو متعلق يعني بالغدة الكظرية. يعني عم بحس يعني بعد ما سويت دايت، بعد ما عملت دايت يعني صار عندي ارتفاع في الكورتيزول.
He's asking about the adrenal gland, actually. And he has adrenal gland insufficiency. That's right. This is your question?
Yeah, adrenal and food allergy.
Allergy. Well, the adrenal gland is related to the territorial conflicts and chronic stress. You can imagine with the chronic stress, we are activating the adrenal gland, which secretes the adrenaline, more adrenaline, and cortisol. And if you have this stress that is for a long time, the adrenal gland will be exhausted and will arrive to the lack of production of cortisol. In this case, we have to identify where you deviate from path, which is related to the territorial aspects and conflicts from one side, and the other side to give you the energy, vital energy, in order to increment and increase the vitality of the adrenal glands. And for each organ, we have kind of food, which is supplements, apart the fact that we resolve the problem and complete the learning process. So we need to give the food in this. I can give you that the broth, the broth.
The bone broth, yeah.
No, a meat broth, not bone marrow, but meat broth.
Okay.
This is the best thing for the adrenal. Thank you very much.
Thank you so much. And thank you
You're
for
welcome.
the value. Thank you.
You're welcome. We have Soline.
مساء الخير دكتور.
مساء النور، أهلا وسهلا.
الله يخليك. أنا طبعا تخلي الواحد يتمنى يكون من مرضاك، يعني شايف هيك شيء دكتور. واحد يتمنى يكون مريض قدك، شايف؟ أول مرة هاي.
She says that she would like to be one of my patients.
Yeah, I would like. No, I hope. I hope. دكتور أنا عمري 52 سنة، ومن سنة 2008 صار عندي breast cancer.
Right
وبعدين
or left? Breast cancer, right or left?
Left.
Left. The left breast cancer is related to conflicts with mother and sons.
Okay.
Mother and son, in which we lose a lot of emotional energy.
اوكي. وبعدين انتقل الى العظم للبون بال 2011.
Yes, it passed to the metastasis for the bones. That mean, actually, for me, there's no metastasis at all. It's not something that passed from one organ to the other. But when the energy, vital energy, drops in other organs due to other reasons, sometimes due to the chemical therapy, The chemotherapy actually leads to drop of the energy, and the first organ that is weak will be the first organ to appear as a cancer as well.
Yeah, and it's become again, it become active again at 2019. And I took everything, medical, chemotherapy, radiotherapy, medicine. I'm taking now very, very strong medicine, which make my immunity system always low.
Yeah.
At the same time, I don't believe in this kind of medicine, but I have no another choice. Actually,
yes, actually, you have a choice. If you understood that cancer is not enemy that you have to kill, but a poor that we have to help. So by giving the vitality, for example, vegetable juice to drink every day, more than 10 cups of vegetable juice, to make coffee enema, to have antioxidants like vitamin C, melatonin, astaxanthin, to sleep well and to make physical exercises and to have a positive relationship around you and to resolve the real problem that in the first place is the cause of the disease.
Yeah, but I heard you once, I'm sorry taking the time of others, but really, because my case is critical a little bit, that you can, with the new medical future, you can heal this disease, this cancer disease. So if there's any ability to...
Yes, I have different cases where with metastasis, I have one case from in Nazareth that 15 years ago came to me with cancer and metastasis everywhere. And today she's still alive. All the metastases disappear except 2 of them that's still there for 15 years. And she lives very good.
So what shall I do, doctor? Please help.
What I said before. Maybe you didn't hear about.
No, I understand, but I need something very, like something strong. Yeah.
Yes, I think the is to increase
spiritual. I mean, spiritual treatment.
No, before the spiritual treatment, you need to increase your vitality by the vegetable juice, by the coffee enema. Write down the coffee enema to do it every day. This lady from Nazareth is doing this for 15 years and she feels very well. Increase your vitality. This is the real answer for the cancer. Thank you very much. David?
Hi, I didn't think it wasn't my time because others were before me, but tell me please about the practical sessions in module 5 or 7. What are we going to learn there?
Yes, this is the energy washout. The energy washout, we learn how to open the energy blockages in the system by pushing different places in our body where the emotions are blocked as well. And by doing this, the patient starts to feel again these traumas from the past or conflicts will come out as emotion, as crying, as rage or anger, whatever, or fear. And we help to complete the learning process by doing this. So exactly all the theory that I spoke about it becomes something that is very practical, and we do this by completing the learning process during this energy washout. This is one technique, and then the fourth course we will learn the feel. It's another technique, fast emotional elaboration and liberation. And in the same course, we will learn as well TTRT, trans-temporal regression technique, where the person can live the past lives and traumas, and to experience the death again, and to see what happened after death, and how it goes on, and take a message and take a mission for this life. So it will resolve the problem by changing the information in the soul.
Thanks.
Thank you very much. We take another question. Salam Al-Hannawi.
Hey, hello everyone. Marhaba, Doctor.
Ahlin.
I have two quick questions. First one,
Yes.
I believe that nothing is incurable, nothing is impossible. God is the greatest physician. Do you think that we can cure everything? Everything is curable if we find the right way to tackle it.
Actually, if you define cure as completing the learning process,
yeah,
everything is curable. So we don't look at the physical body, because Stephen Hawking was completely paralyzed, but he had a state of well-being, and this physical body didn't obstacle him in order to continue his journey and to be a source of biggest information for the humanity. He had a state of well-being, and he lived 50 years more than what was expected.
Yeah.
So if you define a cure as complete the learning process, the answer is yes. But if you define curable, for example, if you have somebody that had a myocardial infarction and you have scar in the heart, this is irreversible. We cannot do this reversible. So we have a new definition for the things in order to understand better. Thank you very much.
One quick question. What do you think about the intermittent fasting or the prolonged intermittent fasting?
There's nothing right for everybody. We tailor the therapy very specific for the person, and in the third course we will speak about the human code, and Carmel will speak about the different continents of the courses. The human code says that we look to the face, we understand your nature and your specific temperament, needs, conflicts, and diseases according to you, and diet, very specific diet and behavior and exercises, and everything is related to your, is tailored for you, specific. There's nothing that is right for everybody.
Thank you very much.
Thank you very much. I give you one last questions. Yes, I see that Nadine has two hands, one electronic and one real.
It worked. Hi, Doctor.
Hi, Alan.
Thank you so much. It's full of vitality. All this presentation, really. So I have so many questions, but I will limit it to two. So you're saying that the combination of food, lifestyle, and energy work, this holistic approach is what we should do, or what we will learn in your modules.
Yes.
Is that right?
That's right.
Okay.
But the main thing is to introduce the psychological and the spiritual aspect that is lacking in most of the alternative medicine.
Exactly. I'm coming from a functional medicine / nutrition school. So they talk a lot about the nutrition and the medicine and the lifestyle, but the last part that you mentioned is not there. So this is why I want to see what's the difference. And if I may ask, what will differentiate what we learn from other schools we see, like the pranic healing, theta healing, and all these modalities?
Yes, actually, we understand each kind of discipline, okay, what is the field that is treating. Now, for us today, it's not enough to act on the energy in order to free the energy blockages, because behind this, we have the psychological conflicts. And behind the psychological conflicts, there is the spiritual need. So we have to arrive to the spiritual need and to complete the learning process in order to prevent the returning of the problem again.
Okay.
Okay. The theta healing, they are working with the genie world without knowing this. And in our classes, we understand, we will take in consideration the spiritual world, how it's made, and the angelic world and the genie world, and how it manifests in our life, and how we can intervene in order to heal even psychiatric diseases, which are completely in the obscure field completely, because they don't took in consideration the spiritual world as the real cause of the psychiatric diseases.
Yeah. Thank you so much, Doctor.
You're welcome. Now I will give the word for Carmel. Where is Carmel? Carmel, here's Carmel. Thank you for your presence. I want to thank everybody for your presence, and thank you. I hope to see you in the different modules. I will be happy to have you in our courses. Carmel will show us, will present for us the different models and what each model contained. Thank you very much.
Thank you very much, Dr. Nader Butto, for the fascinating lecture. I would like to just explain a bit more into depth about the training, the Unified Integrative Medicine training. I mentioned at the beginning that this training has seven modules. 5 of them are going to be online and 2 are going to be in present, which means that the first module we are expecting to start at the beginning of June. And this model contains 4 meetings, which means it's going to be on Mondays evening from 6 o'clock in the evening, Central European time, until 9 o'clock in the evening. And this will be for 4 weeks, 1 week apart. And that will be, for instance, the first level. The second level will be starting then in August, end of August and September. And the whole list of the trainings and the dates are on the website. I've sent it in the chat. The first level we're going to talk about, Dr. Butto will be talking about and presenting the 7 universal laws, which is really the fundament of all the knowledge that he bases on all the levels after. And this is why it's so important, that knowledge of the first level. This will really give us the understanding of phenomena in life and the ability to understand almost everything that is around us. Dr. Butto will also talk about how he unifies the conventional medicine and also alternative medicine, how they both combine. He combines it together and see how they compromise together. He will also really connect the understanding of reality. Yes, that's, for instance, the first level. Then the second level is going to talk more about the body, mind, and spirit, which is more the psychosomatic, looking on when a particular area of the body is affected, what is the psychological crisis behind it. The third level is going to be talking about the human code. So what Dr. Butto was mentioning before, when we see a person in front of us, being able to decode him and understand who is the soul that is behind, what is the body telling us about his character, his attribution, his attraction, what motivates him. So really understanding to read the people in front of us. The fourth level is going to be about the feel and TTRT, are very practical therapy utilities that we can use, using particularly points of the body in order to release fears, whether those are fears of this life or fears that we have been brought with us from former life. The fifth level is about the nutrition, a very innovative way of looking at nutrition from the Unified Integrative Medicine that Dr. Butto has developed. The sixth level is learning and experiencing the emotional energy washout. This is a practical in-person retreat. And the last level, the seventh level, Dr. Butto is going to talk to us and teach us about the spiritual world and the psychiatric disorders and how we can deal with that, understand it, heal it, and work with that. Yes, that's the 7 levels. It's about, all the 7 levels are going to take about a little bit more than a year. There's going to be a gap between one model to another. And in case you would complete those 7 levels and you would like to become a therapist, a Unified Integrative therapist, then you can apply for the training, for the qualification training, which will take about 4 months after. And this is really getting into depth with the practical part of the modalities that Dr. Butto will present us. There's going to be a lot of, of course, revising in depth the information, but also practical exercises, supervision, case studies. It's going to be a lot of hands-on in this training, which will, at the very end, qualify you as a Unified Integrative Medicine therapist, qualified from the center that is representing Dr. Butto and the Unified Integrative Medicine. If you have any questions, you're welcome to open your microphones. I will be very happy to answer.
What I saw that a lot of our guests here, they are the Arab speakers or Italian as well. So we have courses in Arabic and we have courses in Italian as well. So I think that it could be, yes?
Some of them are asking if it is live and just live or live and recorded. Will they be able to?
Yes, it's live and recorded. So if you don't have the time in that day to be and to follow, or you don't have the time exactly that is fit to our time, you can look to the recording registrations and you can see all the lessons. Yes.
I see that David has a question. He was raising his hand.
David.
I opened his microphone.
Okay, I'm sorry. Yeah, do you hear me now? Yeah. So this was actually my question. What happens if I miss a session? Or is it possible to, let's say, to change those practical modules if maybe I don't find the time to do it in 23. May I change to 24? And is it a little flexible? This was my question. Yeah.
If I may answer, then absolutely, you can start to do a level and then decide that if you want to pause or not continue. If you want to pause, you can always come back to the next model in a year after or 2 years after. So that will be granted for you in that sense. Did I answer your question?
Yes.
Yes, and beside of that, I can also mention that beside of having the recording, you will have a supporting learning system behind that. So you will have the written material, the leaflets, the booklets, everything on site, a website which is designated for you as a student, which you will have a constant access to.
Good.
Anybody's having more question? Maybe you can wave. Yeah, just here, Nadine.
Thank you, Carmel. So my question is, when we learn the module, can we start applying what we've learned in that course?
Absolutely, Nadine. Even if on the first level, which is very theoretical, you can immediately apply it in understanding everything that is around you. So you will start to apply the universal laws when you see an understanding why we have 5 fingers, why our eyes, our nose, why the organs of our body are built in the specific way they're built. You understand why there is spirit, body, and mind, why the spirit is built from 3 units to it. So you will be immediately encouraged also to apply this knowledge. In this way, you will be able to deepen your understanding and to make it a very practical tool in your daily life. Absolutely.
And in the 5th and in the 7th, actually, is practical courses as well, where you can, at the end of the courses, you will be able to exactly apply what you learned on the others in order to achieve the state of well-being.
Thank you.
Good. Okay, as Suad, the last question, Suad.
Here's Suad, your microphone is open.
Thank you very much. I have a follow-up question about what if we will be able to use what we learned to heal our own issues. I have asthma that I got just to the last 2 years. It's new, I'm a little bit old. And so is because some of us are dealing with issues right now, would it be possible after taking this training to heal our own selves and starting from first module, would that be possible? Or is that something that will take time for us to learn? Thank you.
From my experience, by understanding why you have asthma, this will already change your approach to life and will be the very beginning of your healing path. By applying other methods we will talk about, this will change tremendously the way your body functions. And then gradually with the levels of applying other methods like the feel and the TTRT, you will be able to treat more and more in depth other parts. So I absolutely believe that it will make a change.
Yeah, the main point here is to make the diagnosis, the first diagnosis. And in the first module, we will learn that the blinking technique, which is a practical one, I can just show how we do it. I imagine you are here and I can feel, you can see that my eyes are blinking. Actually, they are blinking on the chest, and I want to know when it happened, the the problem, what kind of problem you had that made this have a asthma. In 2017, it is in the family, and you have a problem that you felt that some, first of all, you have an abandoned conflict from beloved one. And this was not expressed emotionally. It was repressed inside the lungs, and this created the tension inside your bronchus. So the external factors are not the real reason for the asthma, but the abandon from a beloved one that was not expressed emotionally. I had a lot of patients with asthma that were cured completely after the energy wash out, when they lived and expressed their emotion, especially crying, because this is cry that is blocked in your bronchus. And when it's exposed and goes out, your bronchus will be relaxed again, and they will release. Are you aware about the conflict that you did have?
Yes, I did have an issue that I lost my husband in December 2016. So that's very close to 2017.
Yes. Yeah, and this is a real conflict of to be abandoned, because your husband was kind of father for you, because it was everything for you.
And I lost my father as well 2 years later. So
yeah, it emphasizes the problem, and it comes to tell you that nobody is yours. It comes to tell you to be free, and to apply the Arabic proverb which says, "Do for your day as you are you are going to die tomorrow, and do for tomorrow as you are living for eternity." اعمل ليومك كأنك تموت غدا، واعمل لغدك كأنك تعيش أبدا. Thank you very much for everybody, and we will learn the learning technique in the yes. Irisra. What is your name, Irisra?
مرحبا دكتور، أنا اسمي سوسن.
Susan. It's not exactly what appears in your
اليوزر نيم ديفرنت.
Okay.
أول شيء فرصة سعيدة، شكرا لك على هاي الفرصة. دكتور، أنا بعاني من جلد ناشف من 10 سنين وأكثر، يعني زي الفيش سكيل عندي.
وين بأي منطقة؟
بالإجرين أكثر إشي.
Her problem is that the skin is dry in the legs, the lower part of the legs. Yes.
من الني وتحت.
من الني وتحت. From the knee and lower from the knee, and legs. Actually, first of all, the skin is related to contact with persons. Okay, and the legs, why in the periphery appear when the energy, our energy is low, it start to retreat, it start to goes into the center in order to maintain the energy for the vital organs. So you have a contraction, and this contraction appear as a dry skin, and the dry skin is related as well. Why the legs related to kidneys, and kidneys related to material conflicts, money and material things around you, that makes the vital energy of the kidneys to be low from one side, and the the skin is related to a sense of to be separate from somebody that it was near to you. So when you combine the two things together, you understand why the skin and why in this area and not another area. So all the skin will be contracted, but it's contracted in the periphery because the vital energy is low in this area, and this is the reason why this is the first area where the problem will appear. So increase your temperature, physical activity, emotional energy wash out, and to feel freedom, and to be the source of love for others instead to be dependent on the love and recognition from the other. You are the source of love, and this is the good news.
Thank you.
Thank you very much. Thank you, everybody, and I hope to see you in the different models. Good night and bye-bye.
Thank you, Dr. Nader Butto.
You're welcome.
Thank you all.
From the heart. Thank you very much.